I've always been a unique person, you know what I mean? Sort of laid back in a way, but very adamant and very passionate about what I believe. I think a lot of times that sort of throws people off because they don't expect me to have the mindset or the process of thought that I do. And so when you come in to watch my channel, you may hear a myriad of thoughts and ideas that could be different from others. What I want you to do is just sit back, like, share, and subscribe. To receive instant notification each time I upload, please hit the subscribe button and the bell notification.
Helping you along the way, helping you to make it through another day. Yeah, everything you need to know that you never knew, that you need to know. Like our perspective.
Well, hello and good morning. Welcome to the Lockhart Perspectives, Fifi's Coffee and Jazz Cafe. Whew. It has been an amazing couple of days off. I'm so glad to have everybody with me this morning. Oh, yikes. It is so great to be here. Well, as you guys can see by the title today, we are digging into the old Medicare and healthcare and science world. Want to see what's going on. Want to find out what all the hubbub is. Oftentimes we hear about a lot of changes and stuff like that inside of healthcare and Medicare. Those things that are like, you know, for us, for the older folk. We hear about a lot of the stuff. But what we don't know is oftentimes how we got there. And that's what we're going to talk about today. We're going to take a look at some of the stuff that's going on and how they got us to be in the situation that we're in with a lot of the different laws and a lot of the different arguments, and how did they end up charging more for this or that? Or you're sitting around, you're having coffee with your friend, and you find out that, well, not only are they charging them more or less, but they're doing something totally different to another group of people, and you want to know how that happens. Well, today when I say we've got the skinny, we've got the skinny. But before we get into the skinny of it all, I want to say hello to a few people who are here with us this morning, and I'm really happy to see everyone. The first two gals at the party this morning was none other than Mama Bear, Papa Bear, as well as Miss Amy Duran. Good morning to you, and it looks like coming right behind you was Angela Courtwright Kahlo. Good to see you this morning as well. Good to see you, ladies. We got the Supremes. That's going to be your name for today, the Supremes, because you guys were here first. And then we have William Craig. Good morning to you, kind sir. We like to get the good mornings up and running really early so that we can get into the juicy meat of it all. And then there is Alan Davis. Ain't nobody like this cat right here. Hilarious. How are you this morning, kind sir? It is so good to see you, and I am glad that you are here with us this morning. So then, let's see. We've got the loving on everybody. There we go. There we go. And then we have Vine Dressers Branch. What a well thought out name that is. It's my first time seeing you here in the chat, and so I want to personally thank you and welcome you to the channel. Welcome for visiting with us today. Melvin Thomas Jr., good morning, kind sir. Great to see you. Yes, everyone is just saying hello. See, I love it. I love it, William. I just love it, William. I just love it. And there is none other than Charlie Sigler here this morning. How are you? Hello, beautiful people of the room. Amy, Angela, Mama Bear, William, Alan, Vinedresser, Melvin. The love just flows and flows. As long as the love flows, everyone, we will always stay on top. No matter what environment we're in, no matter where we go, as long as we show love, we can pour that out. Did you know that we can give as much love as we possibly want to? I hope everybody got their coffee, because you know I do. I've been down for a couple of days. So, just had my last cup of tea. Now I'm having my coffee. Well, I got to, because I'm here with y'all. Share Witty Therapy Chair, how are you? Good to see you. Good, Charlie, good. Everybody's loving on Charlie and Share Witty Therapy. There you go. There you go. So what you get for coming in here. If you didn't want no love, you shouldn't have came in this room. I'm so glad to see all of you all. Well, it looks like we have loved and hugged on each other that's here so far as folks come in the room. Marty Lauderdale, good morning, lady. Good morning, good morning. As folks come in the room, I hope that we will not forget to welcome all of them as well. Well. We do have some stories today. And yeah, here's the skinny. I want to ask you all, let me close this out right here. I want to ask you guys if you have been keeping up with any of the stuff that we just mentioned. With regards to the, I'm going to close out of this one because I want the other story. Yeah, the other stories. Have you guys been keeping up with any of this? With any of this hubbub with regards to the Medicare? Are any of you old enough? Gee whiz. You know, a lot of you may not be old enough to keep up with it. And so therefore, I'm just, shooting a couple of blanks here. You guys may not be old enough. You guys may be just a room of teenagers. But what I want to go on ahead and talk about right quick, let me open this all the way up. I'm doing this a different way, you guys, today. So I hope everything's okay. Hope you guys will work it out with me. We got some more stuff. On cup number 2, Mom Fuel, mug on deck. Very good, very good, very good, very good. I hope that you guys have text folks that aren't here. If you haven't seen somebody, I hope that you're letting them know we're missing them. And, we're checking on them. I check on people. I do. I check on folks. All right, so here we go. So, just recently, they, at the top of this week, as a matter of fact, we found out that the Supreme Court was going to hear the case on the 340B payments. Now, don't worry if you're not familiar with what the 340B payments are. That's all right. As I move my mic a little closer to give you all this coffee this morning, don't worry, I got you. Okay, don't worry. I'm going to get you abreast on exactly what's going on. Hopefully by the time you leave this morning, you'll know exactly what they're doing with the money and who's doing it and who's arguing and who refuses to just give it back. One other thing. It'll also clarify for you how people are interpreting some of these different laws. All right? So let's go way back, shall we? We're going to start with May 7th of 2019. Now, get me. It started a whole lot earlier than this, right? But we're just going to get you up to speed. All right, here you go. So, May the 7th, 2019, the judge halted the 340B Medicare rate cuts for the hospitals. So now if you go to the hospital and you're trying to figure out, why is something not right, or why is this price, what's going on, this will help you understand how come your medications were different, and how come, you could talk to somebody else and their medications were a little different. So a federal judge on that Monday in the week of May 7th, 2019, All right. A federal judge blocked the Trump administration's Medicare cuts to the 340B hospitals. Now, they were saying that the new rates were not lawful for 2018 and 2019. However, U.S. District Judge Rudolph, remember, we're getting caught up to what just happened at the top of this week. But you can't know what happened at the top of this week if you're not following. So that's why we're going way back. Okay, so now the secretaries, however, the U.S. judges, Judge Rudolph Contreras, did not grant hospitals the permanent injunction against the cuts that they wanted. Instead, he ordered the department to take the first crack at a remedial measure with a status update that would be due that August of that year of 2019. Saying, quote, the secretary's deficiencies were substantial. The judge wrote in a decision late that Monday. He patently violated the Medicare Act's text. Unlike cases in which the agency's decision may have been lawful but was inadequately explained, no amount of reasoning on remand will allow the secretary to re-implement the 340B rates in the same manner. The decision follows a series of lawsuits that were led by the American Hospital Association against the initial rule that slashed Medicare Part B drug reimbursement rates for hospitals that received the 340B drug discounts. The legal battle started late in 2017, before the 2018 pay rule first imposed the cuts went into place. Contreras rejected the HHS claims that the hospitals should have gone through the agency's administrative process rather than the courts to address their problem with the 340B cuts. Okay? Now, the judge said that he decided not to give the hospitals an injunctive relief because eliminating the rule would wreak havoc on Medicare since the regulations first went into effect in January of 2018. Specifically, Contreras noted that the HHS can't add to the department's expense. If the department retroactively raised the 340B hospitals' pay rates for 2018 and 2019, then it would have had to have retroactively lower the other Medicare rates at the same time. And because HHS has already processed the claims under the previous rates, the secretary would potentially be required to recoup certain payments made to providers. Now listen carefully, everybody. An expensive and time-consuming prospect, the judge wrote, estimating that it would lead to $25 million to $30 million administrative dollars in costs alone. In a joint statement, the AHA and the Association for the American Medical Colleges, as well as the America's Essential Hospitals, said that the 340B hospitals welcomed the ruling. Now, they said, quote, we urge HHS to promptly comply with the judge's ruling and restore the 340B hospitals all the funds that have been unlawfully withheld. Now, this is what the group said. Capitol Hill lawmakers want the 340B program to undergo a more reform, and the GOP members wanted at that time the House of Representatives previously prioritized legislation to tighten the scrutiny of the 340B hospitals and how they spent the money they received through the manufacturer's discounts. I don't know whether you guys can see it or not, but this is like one big ball being tossed back and forth. So if you ever want to know why something didn't get paid, or why it was slow paid, or why maybe you had to pay more, or why maybe mama and them or daddy and them had to pay something else, or, crazy things, this is it. This is really the crux of why. When you really want to know why, this is really why. Now, let's fast forward a little bit, all right? So now, the Capitol Hill lawmakers, remember this, Capitol Hill lawmakers want the 340B program to undergo more reform, and GOP members of the House of Representatives previously prioritized legislation to tighten scrutiny and on the 340B hospitals. So they want them to tighten everything up and how they spent the money they received through the manufacturer's discounts. That policy's momentum has died since the Democrats took control of the chamber back in 2018. All right? All right. Here we go. Now, May of this year, all right? May of this year, the HHS warns drug makers that won't give the discounts to the contract pharmacies, the 340B contract pharmacies. HHS Health Resources and Services Administration on Monday sent a letter to 6 drug makers warning them that they could face steep fines if they don't discount drug prices for pharmacies that contract with the 340B providers. Pharmaceutical companies started aggressively cracking down on the 340B drug discounts through contract pharmacies and demanding more data from healthcare providers last summer. They have been seemingly testing how far they could challenge the HRSA, their guidance that allows the 340B providers to receive discounts while working on multiple contract pharmacies. Now that led to several lawsuits from community health centers and hospital groups. So where are we getting down to? We're getting down to the little guy. We're getting down to the little guy. We're not getting up to the big guys. We're getting down to the true, blue collar worker that maybe didn't have a whole lot of retirement or who maybe didn't have a whole lot of savings or something. But the little guy is going to be the one that's getting this. That's the reason why we have to focus on the fact that it's the small health centers and hospital groups, the little bitty small ones. All right? Okay. All right. You guys say hello to anybody else because I can't see a thing on that side. I can't see one thing, not one. All right. So now the drug makers, now listen, here goes some names I know you're going to really raise your eyebrows to. Because I raised it to mine, which is the reason why I'm bringing this story to you guys. All right. Now, the HRSA issued an advisory opinion in December saying that drug makers could not charge a covered entity more than the ceiling price for the 340B drugs. Okay? Now, the agency is threatening to slap drug makers with fines of up to $5,000 per overcharge if they did not follow the rules and refund the covered entities for the past overages, the agency said in an announcement. The agency, who is this outside my house? The agency sent letters to AstraZeneca, Lilly USA, Novartis, Nova Nordisk, Sanofi, and United Therapeutics. Do any of those names ring a bell? Well, apparently they got letters. They all got letters. They said, quote, a drug maker must immediately begin offering its covered outpatient drugs at the 340B ceiling price to covered entities through their contract pharmacy arrangements, regardless of whether they purchase through an in-house pharmacy. The HRSA acting administrator, Diana Espinoza, wrote. Now, the hospitals felt vindicated by this announcement, but the particular day's action, as this is written, says, quote, they say, quote, today's action by the health resource and service agencies is an empathetic defense of the 340B drug pricing program and the thousands of safety net hospitals, health centers, and clinics serving millions of Americans with low incomes. Aha! Who's getting the brunt? And those in rural communities. The 340B Health and Association of more than 1,400 hospitals said in a statement, "As we have been saying for nearly a year, the 340B statute requires drug manufacturers participating in the program to provide discounted prices to support the health care of patients. And the denial of these discounts has damaged the providers and the patients, and it must stop." That's the bottom line right there. See, this whole big argument, they put this fluffy language in there, and then they allow one side's attorneys to, how do you say it? To basically decide how it's interpreted. That's basically what they're doing. They get the big fancy language, and then they allow each side's attorneys to try to, well, this is what it really means, and we're going to go for that. But whatever it is, it's going to line our pockets. No matter what it is, we're going to make sure that it's very confusing. And if it's confusing enough, then we're in the clear. We'll be all right until somebody comes back and tells us to fix it. By then, we would have gotten all of our bonuses and we would have left. So it doesn't matter. Just do what you do. Just get me my bonus. Basically, that's what this is, basically. So let's read that again. Today's action by the Health Resource and Services Administration is an empathetic defense of the 340B drug pricing program and the thousands of safety net hospitals and healthcare centers and clinics serving millions of Americans with low incomes and those in rural communities. Now, this is the 340 Health Association of more than 1,400 hospitals said in a statement that we've been saying for nearly a year that the 340B statute requires drug manufacturers participating in the program to provide discount prices to support the care of patients. This is the reason why my mother's medication jumped. Huge number that nobody could answer it. You know why? Because neither side wanted to take the brunt of the deal. My mom ended up picking it up. Yeah, that's it. The denial of these discounts has damaged providers and patients, and it must stop. It is vital that these companies immediately begin to repay the millions of dollars that are owed to these providers. Drug makers have been upset with the rapid growth of contract pharmacy usage and sought to restrict the discounts they provided to on-site pharmacies run by covered entities or a limited number of contract pharmacies if providers did not have an on-site option. But HHS General Counsel Robert Charo wrote in December advisory opinion that drug makers could not restrict their discounts, as less than 5% of the covered entities had an on-site pharmacy. Quote, the site of delivery, be it lunar surface, low Earth orbit, or a neighborhood pharmacy is irrelevant, Charo wrote. Pharmaceutical companies have argued that such actions were necessary to prevent diversion and duplicate discounts. But Espinosa said drug makers could only address their concerns by going through the process outlined by the 340B law, which requires drug makers to carry out an audit and file a claim with the government. We got to do the same thing. Anytime we have a disagreement, we got to do the exact same thing. So why are they different? Quote, she wrote, quote, the 340B statute does not permit a manufacturer to impose industry-wide universal restrictions, she wrote. The Pharmaceutical Research and Manufacturers of America defended the drug makers' actions. They said, quote, the fact that the contract pharmacies were never authorized by Congress in statute, nor does the 340B statute require manufacturers to ship 340B medicines to contract pharmacies. Contract pharmacies only appear in sub-regulatory guidance, which cannot impose any binding requirements on the public and lack the force and effect of law. This comes from Nicole Longo, a pharma spokesperson. She said this in an email. Pharma is concerned that contract pharmacies have too little oversight and that there is a lack, see the back and forth, and that there's a lack of evidence that their participation in the 340B program has improved patients' access to medicines. Quote, that's why we're advocating for meaningful improvements to the program that ensure patients directly benefit from the tens of billions of dollars in discounts that manufacturers provide each year, Longo said in a statement. But the HRSA's warning letters show that the agency will continue to enforce the rules as it sees fit, even if the drug makers disagree with its interpretation of the law. Eli Lilly, AstraZeneca, and Sanofi They each sued the HHS in February, arguing that the HRSA's December advisory opinion was inconsistent with the law passed by Congress and that the drug makers might not get a fair hearing. I'm so tired of pandering to these guys. I'm really, really tired of it. That's all we do is pander to these guys. If they file a complaint, they may not get a fair hearing if they file a complaint. Sanofi said that its complaint, that it's worried. These people are tripped. They're billionaires. Sanofi said in its complaint that it's worried that HRSA's Alternative Dispute Resolution Board would consider the advisory opinion binding since the HHS officials make up the board. Well, hello. That could lead to crippling sanctions, the complaint said. How many times have we been saying all along that some things just ain't right? When it comes to this board sitting all together, you got the same board, the whole board, everybody's sitting together that knew each other. We just said this last week, that you got these people that know each other from this place, and you got these people that know each other from that place. Remember we were talking about that. Yeah, we were just saying that nobody gets a brand new job. They just shuffle them around a little bit. That's all they do. They just shuffle this cat from this place. That's it. They shuffle one from over here, and then they shuffle the other guy from over there, and then the other guy goes back over here, and he remembers, this is my friend from this place, and everybody is just fine. Nobody is any of the wiser. And meanwhile, we're the ones down here holding the bag, wondering what the world is going on. How did my mother just get through paying all of that money for a medication that she's been using for X, Y, or Z? Now, let's get another little sneak peek, because what we're really doing, you guys, is connecting the dots. That's why we're reading all of these stories together, because what they hope that we do is we do not remember what happened the last day, that something happened on the other day, because what had happened was. Now, the top of this week, November 29th, 2021, all right, the Supreme Court questions HHS's interpretation of the DSH formula. So now there's a formula in the way that they come across, how they come up with dollars. Okay? I got to close this out so that I can sneeze. But I don't know how to get around there to you guys. So I think I just better do it. Boy, that'll be pretty unattractive. Yeah, you'll never look at me the same. All right, so anyway, let's just get on to the story. The Supreme Court justices on Monday were skeptical that the Health and Human Services Department fairly interpreted the Medicare law when it changed the formula for disproportionate share hospital calculations. During oral arguments, the justices asked pointed questions about the specific language the HHS interpreted to create its DSH formula. Remember, that's how they come to the discounts and how they come to the pricing. They wondered whether the department should receive a wide latitude for interpreting congressional language dictating the policy. Quote, so it strikes me as a situation where I think we ought to be particularly precise in interpreting the language Congress used without any gloss added by the agency. Now, this comes from Justice John Roberts. HHS made procedural mistakes during the original rulemaking process in the early 2000s. The DSH payments are determined by measuring the number of inpatient hospital days, for which a patient is entitled to Medicare Part A and supplemental security income benefits. Those figures are combined with a measure of a hospital's overall patient care days for beneficiaries who are eligible for Medicaid but not entitled to Medicare Part A. HHS decided beneficiaries who've used up all their inpatient days covered by Medicare Part A would be included in the Medicare fraction, increasing the number or the total number of Medicare inpatient days in a hospital. This potentially decreases the DSH percentages for hospitals depending on their patient population. Now, Justice Brett Kavanaugh said, quote, "It's a laudatory motive, but the question is the statutory language getting in the way?" The justices also questioned Empire Health Foundation, which originally sued HHS over the rule on whether, get this, quote, entitled to, and the other bit of language, eligible for. So these two phrases, okay, Empire Health Foundation was questioned about, which originally sued the HHS over the rule on whether entitled to or eligible for really have different meanings. Entitled to or ineligible for, just let that sink in. Meanwhile, the time is still ticking and people are still not having any coverages. All right, so an earlier Ninth Circuit decision sided with hospitals. Medicaid law uses the phrase eligible for benefits and Medicare uses entitled to because Congress intended them to mean different things. The Ninth Circuit said because of that, beneficiaries who have exhausted their inpatient days should be counted in the Medicare fraction. Now, Justice Elena Kagan said the government's proposal to have two formulas for two separate populations makes more sense than the hospital's idea. But the legal experts aren't confident the High Court will use this case to make broader statements about the agency's authority. If the Supreme Court sides with HHS hospitals, with a large number of Medicare beneficiaries whose coverage is exhausted, could see their DSH dollars decrease. Now listen, according to what Thomas Baker said, who is a co-chair of the healthcare practice at Foley Hong, a former CMS general counsel, hospitals are concerned about further decreases in payments as cuts from the Affordable Care Act, set to start in 2024, and the Build Back Better Act proposes additional cuts for hospitals in states that have not expanded their Medicaid. But the case could ultimately affect the HHS and other federal agencies' future authority to interpret laws if the High Court decides that they are acting out of bounds. The Supreme Court may have decided to hear the case along with another one on the cuts for which is what we were just talking about a few seconds ago. Okay, so these are supposed to be sort of combined together. All right. So that was the case that we were just talking about. Remember, we just mentioned the 304, the 340B. Okay, so the Supreme Court may have decided to hear the case along with another one on cuts to the 340B payments to reel in federal agencies' power to interpret congressional language, Barker said. while many court watchers pair this case with the one that we're about to go into that was done for the 30th. I have to give you all of that just for you to get this. You got to keep your eyes on this, especially if you're like me. If you're creeping into that age category, or if you're already there and you're trying to figure out why and what the hubbub is, this is the hubbub, and this I submit is really important stuff. Because you're not going to find out exactly what everything is. Because nobody's going to take this kind of time and give it to you. I trust and believe. They're just going to tell you, this is the way that it is, ma'am. This is the way that it is, sir. This is the amount that it is. And you're trying to figure out, well, why hasn't it been paid? Or why hasn't this happened? Or why am I getting a bill? Or what's going on? Because they're shuffling stuff around. They're not as organized as you think they are. At all. And they're not as organized as they try to pretend like they are. Because somebody got their hands in the cookie jar all the time. Okay? Quote, if there's a case where they want to say you're being unreasonable, where you're not warranted deference, I think that tomorrow's case is a better candidate for that. So that means the case that we're coming up on and we're going to close up with. Now, on the 30th, the Supreme Court heard the case on the 340B payments. Hospitals made their case before the Supreme Court on this past Tuesday that reimbursement cuts to the 340B drug pricing program made by the Centers for Medicare and Medicaid Services were made unlawfully. The American Hospitals Association, the Association of American Medical Colleges, the America's Essential Hospital, and other provider groups asked the court to reverse a nearly 30% cut in the 340B reimbursements CMS initiated in 2018, arguing that the changes were illegal because the agency did not conduct a survey to determine hospitals' average drug acquisition costs. Instead, the CMS based the 340B payments on the average price for the drug, a calculation formulation by the secretary that resulted in $1.6 billion reduction in reimbursements in the first year of the changes. Those are the two options allowed under the law to determine Medicare reimbursements for drugs purchased by hospitals. But the plaintiffs argued that CMS illegally set different reimbursement rates for hospitals participating in the 340B program and non-340B hospitals, which are mostly for-profit institutions. The non-340B hospitals are mostly for-profit institutions. Quote, Congress spoke directly to the question of when rates can be based on acquisition cost and vary by hospital groups, and that's when it conducts a cost study, said Donald Verrilli, the counsel for the plaintiffs in the case. He later added that if you don't want to do that, if you think it's too burdensome, or if you think it's a bad policy, then you go to Congress and you say, change the law. But they didn't do either of those things. Instead, they took a shortcut that the statute does not authorize. The 340B drug pricing program allows providers serving large numbers of low-income patients to buy drugs at deep discounts from drug manufacturers and sell them for higher prices to Medicare and commercial insurers. 340B providers and supporters of the program argue those, quote, savings help participating not-for-profit hospitals provide services for low-income patients and cover uncompensated care costs. But the Trump administration in 2018 reduced reimbursement rates to the 340B providers, arguing that it needed to be brought more in line with what hospitals were paying for the drugs. The government on Tuesday argued that its cuts are allowed under the law and that Congress permitted it to vary reimbursement rates between the 340B hospitals and the non-340B hospitals. The non-340B providers are still reimbursed by Medicare for drugs at the average sales of plus 6%. Under the changes made in 2018, 340B providers are paid 22.5 less percent, 22.5% less than the average sale price. This still amounts to a profit for the 340B hospitals, but not as large as what they received before the changes were made. The justices said on Tuesday they all expressed skepticism with the government's argument. Okay? The differences between the reimbursement rates between the hospital acquisition data rates based on average price could mean lost money for the 340B hospitals. Justice Clarence Thomas asked the government's attorney, Christopher Michael, why the HHS would ever change rates under the first option through conducting a survey, when it could just skip the survey and set reimbursement by the average cost. The survey still provides a lot of benefit to the agency, Michael added. But he also added that HHS only conducted the study one time in 2020 while the case was pending, and that the data was similar to the data of the average prices used by the agency for calculating the rates. Hospitals and onlookers are worried that if the Supreme Court sides with the CMS, that it could give the government more power over how to interpret the laws passed by Congress. Judge Neil Gorsuch asked the government counsel how much ambiguity is necessary for an agency to claim they should be given wide latitude to interpret the law. But Michael said that he believes the congressional statute is clear. Varela revisited Gorsuch's question later on, saying, how much ambiguity is enough? I think the answer is way more than you have here. The Supreme Court agreed to hear the case after the U.S. Court of Appeals for the D.C. Circuit sided with HHS. A lower court earlier sided with the AHA. Do you see this going back and forth? And yes, we had to read it all because there's a lot of people in this group that are not spring chickens. Yeah. So do you see a lot of siding going back and forth? Do you see a lot of stuff going back and forth? I do. I really, really do. I see a lot of stuff going back and forth and back and forth. And one person saying that it's them and it's them. So by the time it's all done, who's going to be paying? Who's going to be laying up waiting to get some medicine? Who? I ask. I submit. Who? Gotta blow my nose. Hold on. Gee whiz, that wouldn't have been polite. Boy, I'm so glad everybody was checking on me yesterday. I was getting text messages, emails. Hey, where are you? Are you okay? Hey, where are you? Are you okay? Okay. Now, I want to ask you guys a question. Has anybody experienced pricing and things going a little bonkers? Do you find that this whole entire situation is a bit much? Yeah? Yeah. And are you tired of it going around and round in circles? I am. It's just going around in circles and nobody is going to get off of this ship. Here's my question. I don't mean to be yes, I do. I'm going to start some mess. I'm going to start it. Ain't nobody else better to start it but me. Let's get this party started. Let me start some mess. Do them people coming over here that's not supposed to be here, that's getting free medical, have to go through all the stuff that we're going through, listening back and forth and back and forth? Alan Davis says, time to prepare for stepping out of the beast system. I anticipate that the benefits will become conditional. Yes. So very right. The former medical biller, part of me, head in hands. Oh my goodness, this mess. This is a mess. This is going to be. Yes, and that is your field. I know it. This right here is a mess. I saw such a Medicare changes mess in the small office I worked for. Even back then, the effect on doctors, the practice, as well as the patients. Yeah. An astronomical jump in prices, absolutely. The richer they are, the greedier they are. And all they got to do is just shuffle. You know, they're coming after me. I got to leave and take my bonus with me. Are you ready for a new job? Yeah, I'm ready. Okay, great. You try it now. Now you're going to be the CEO. Go right ahead. I'm a heart patient, and I'm looking for holistic options for my heart meds. Oh, Alana. Oh, baby. Oh. I hope you can find something. Find a holistic doctor. Sometimes chiropractics will see you for the first holistic side of things, Alan. That comes from Mama Bear, Papa Bear. Now, we're not giving any medical suggestions or any medical advice on this channel. Just before they get at me, okay? I don't need nobody getting at me, okay? All right? So now, Alan Davis, I'm sure alternatives are out there. My husband lowered his cholesterol. You see what he did it with? That's very good. Oh, fish oil. It's good. I'm reading all your comments. Oh, I know, right? I know. Don't we all feel like that? We all feel like that. Interesting fact. Oh, I'm sorry, Mama Bear, Papa Bear. Putting everything on the screen so that you all can read it. So yeah, I think that it is changing rapidly, but in that it's changing rapidly, it's really important that everybody understand the background to all of this, because they're not going to give you the background to all of this. The only thing that they're going to tell you is, well, that's just the way that it is, ma'am, because the person that's shoveling that information over the phone or across a counter, that's all they're going to tell you. But there's no way you can tell me that this is just staying between the two sides, or the 3 or the 4 or the 5 sides. No, you are bearing the brunt of this. We are bearing the brunt of this. The seniors, the people who are older, the people who have, worked forever to do all the things that they have done and to give all of the contributions to the nation, which really doesn't mean the rat's butt anymore. I understand that to some of these folks. But the fact is that, yeah, these are the things that we need to know. Disciple of the Messiah One, good morning. Good morning, Christy Easley. How are you? It's good to see you. Christy, it's good to see you. Disciple of the Messiah One, good to see you as well. Right? I mean, yeah. Angela says, you have no idea how the Lord had to deal with my heart regarding the freebies and benefits certain patients got. Meanwhile, dealing the fight I had to get my mom Medicaid coverage. You see, these things are amazing. And this is why I'm saying that's why we had to read this whole piece. We had to get into it. We had to sink our teeth into this. There's no way that we couldn't, because we're not going to be ignorant of their devices. So we understand exactly what the conversation is, right? Yeah, we understand. Now, we got a little bit more info here. Where's my thingy? Where is my thingy? My thingies. Where are my thingies? Where's my notes? Where's my other notes? Other notes? Got some more notes for you. Oh, I tried something new today. Huh. But it looks like I lost them. But I lost them. Baby, I lost them. Yeah, I'm feeling a little bit better, but I'm still sort of stuffy. It's like right up under my eyes. Right up under where my glasses are. See where my glasses are? At the bottom. All the way up under there. It's stuffy. And then right before my lip. So it's stuffy up under the eyeball and right at the nose, at the bottom of the nose. It's like stuffy. And it's like stuffiness getting stuck in there. And I can't figure out why. Yeah, don't know why. Everybody in the house is all hacking. We're all hack-a-lacking. Ugh. I don't know what's out in the air today. I don't know what's been out in the air for the past few weeks or whatnot. But I do want to say that it's something. And I'm still looking for my notes. Still can't find them. Because I don't know how to use the sticky notes. I don't know how to use the sticky notes well. But in any case, I digress. I know how to skin a cat a little bit better than that. So let me just go on down here and find something. This is what you're going to find out. Don't know where my notes went, baby. But I know one thing. I'm going to show you guys the story. All right, so look at this. This is what I wanted to bring you guys. I found it very curious that at the top of last year, we heard some insertions for HIV and a couple of other diseases in a certain thing. And so now all of a sudden, well, let me just show you. Let me just show you right here. Where is his face? There's his face in the place. Now let me open this back up because I need to understand this. I need to understand why this cat did this. Because doesn't okay, HIV and AIDS Day is in September. I looked that up last night when I was glancing through this story, and it made me a bit curious. Why are we focusing on this particular topic right now? Why? Gee whiz, I wonder. Well, the reason why we're focusing on it is because of the fact that I'm going to tell you in a second. Because I don't want nobody saying, oh, she said this and oh, she said that. I got to really parse my words sometimes. I really got to be careful how I say stuff. Where is it? It's about in right there. Is this for the state? Okay, so you guys remember at the top of last year, I believe it was the top of last year, or the end of the year before, where they were giving, unfortunately, they were receiving, after they got inoculated, they were receiving false positives for HIV. Does anybody remember that? I believe it was in Australia. I know it was, because here's my story. I had to piece my story back together because I lost my notes that I had made this cute little thing. But anyway, won't be doing that anymore. Going back to the old school. Just going to go on ahead and, print it all out. Yeah. All right, so let's get all this together, right? I want y'all to get this together. I want y'all to get with me. National HIV Days, National HIV AIDS and Aging Awareness Day. Now, September the 18th is the date. Now, I'm not sure if this is how the date that they keep it or just the date that they had it, but it just says that September the 18th is National HIV AIDS and Aging Awareness Day. Why do you put AIDS and Aging Awareness Day together? I guess you couldn't find another day. But anyway, it says a day to call to action, a call to the attention of a growing number of people living long and full lives with HIV and the aging-related challenges of HIV prevention, testing, treatment, and care. People with HIV are living longer thanks to treatment with HIV medicines, according to the Centers for Disease Control and Prevention in 2016. Nearly half the people in the United States who were living with the diagnosis of HIV who were age 50 or older in 2017, approximately 1 in 6 new diagnoses occurred in that age group. Y'all better hear what I'm saying. It's what I'm not saying that you need to put 2 and 2 together for. Approximately 1 in 6 new diagnoses of HIV occurred in the age group of 50 or older. People aging with HIV can face treatment-related challenges such as drug interactions between HIV medications and medicines used for other conditions. Older adults also face HIV prevention and testing challenges. The CDC reports that among the adults aged 55 or older who received an HIV diagnosis in 2015, 50% had been living with it for 4.5 years before they were diagnosed. A delayed diagnosis means treatment with HIV medicines is also delayed, but gives HIV more time to damage the immune system. Late diagnosis can occur because older adults may not think that they are at risk of HIV, and they may mistake HIV symptoms for those of normal aging. Healthcare providers may not always test older people for HIV infections. Please understand and hold on. Okay, keep your finger there. Now, Biden yesterday says that HIV/AIDS strategy needs to confront inequity. Connecting some dots. Let me blow my nose. Hey, Steve Willis. Okay. So now we're going on to Biden. Okay? You guys just heard that. Y'all just heard that. All right? I'm going to share this with you. Now I'm just going to read it. You don't need to be bothered with all of that. So Biden says that HIV and AIDS strategy needs to confront inequity. Remember what I say. Whenever we get into this whole inequity thing, it's always leaning towards a specific couple of groups of people. And you need to always raise at least one of your Dwayne Johnson eyebrows. Raise at least one rock brow. President Joe Biden on Wednesday unveiled his new HIV/AIDS strategy to end the more than 40-year-old epidemic, calling for a renewed focus on vulnerable Americans, including gay and bisexual Black and Latino men, who his administration says are too often stigmatized even as they are disproportionately affected. The new strategy, which declares racism on a public health threat, was released on the annual commemoration day of the World AIDS Day, and it is meant to serve as a framework for how the administration shapes its policies, research programs, and planning over the next 3 years. But Biden acknowledged that the country will still need to work to destigmatize HIV/AIDS and noted that the LGBTQ and racial minority groups have endured the brunt of the epidemic that's killed more than 36 million people worldwide, including 700,000 Americans. President Biden said, quote, "I want to make sure that everyone in the United States has their HIV status, and everyone with HIV receives high-quality care and treatment that they deserve, and that we end the harmful stigma around HIV and AIDS," Biden said. The new strategy asserts that over generations, structural inequities have resulted in racial and ethnic health disparities that are severe and far-reaching and, quote, "unacceptable," the president said. Today's HIV treatments not only give people with AIDS virus a near normal life expectancy, they can make those patients less likely to infect other people. There are also medications that can help to protect healthy people who are at risk from their infected sexual partners, a strategy known as pre-exposure prophylaxis, or PrEP. Now, I'm not going to read the rest of this, but all of this will be in the description. What I'd like to go to is this. This is what I'd like to go to. And for this, I will share my screen. So, does anybody remember one of these stories where they were saying that people were coming up, unfortunately, with these false positives? December 11th, 2020, Australian vaccine abandoned over false HIV response. A promising Australian candidate for a coronavirus vaccine has been abandoned after the trial participants returned false HIV positive results. Australia had previously agreed to buy 51 million doses of the vaccine being developed by the Australian firm CSL and the University of Queensland. The government said orders of other vaccines would now fill the shortfall. The government said that it would now fill the shortfall with other medications. CSL and UQ stressed that the positive results were false, meaning the trial participants' health was not at risk. Somebody quick, remember which one in America that gave the exact same results. Quick, quick, somebody get me, spot me somebody. Somebody in the chat, spot your girl. The Australian government said that it now entered an agreement for the Novavax vaccine and upped the existing order of the Oxford's AstraZeneca vaccine. The UK was the first one rolling out the vaccine from Pfizer that passed that particular week in 2020. What happened with the CSL vaccine? The vaccine had been staged in one of the trials and proving to be effective in making antibodies. But it also generated HIV antibodies in some of the recipients, which meant that it showed false positives for HIV. Further testing proved the HIV wasn't there. CSL and UQ said fixing the flaw would take about a year, prompting a decision to abandon the trial. Quote, it was likely to work, but we knew that we didn't want to have any issues with the confidence and this false positive test that may have caused some confusion and the lack of confusion, said Brendan Murphy, the Secretary of Australia's Department of Health. I'm not going to come right out and say it because I have the smartest chat on the planet. But somebody getting somebody ready for something? Somebody getting somebody... I'm not going to say nothing. I ain't saying nothing. I just read the reports. That's it. I put it all together. Where your money going with our Medicare for those who are on Medicare, those who've worked and who now get Medicare. But at the top of last year, there had been a report that was submitted. And the report was submitted from 3 physicians from India. And it was given to a very notable medical journal. And this medical journal posted and publicized this exceptional medical report that was submitted by these 3 physicians who worked together that looked at the strand of this candy bar. Actually, not even the candy bar, the thing that comes before it. And they saw that there were 3 little patch pieces put in. One of the patch pieces was the topic we just read about. And 2 of the other patch pieces was 2 other things that we've already heard about in the very past. But it was submitted to a very notable journal. Won't say it here, but I think if you guys were with me when we got zapped last year, you'll remember which one, because that was the one that zapped us. It got us zapped. But I got zapped. And now these are the other pieces to that puzzle. Yeah. So what I would say is, absolutely, Steve Willis, watch it closely. Watch it closely, because the deal is that last year, remember when we got zapped? Got zapped. And it was because we had read that particular report. Won't say the name. So what you getting prepped for? What are they prepping us for? Yeah, I know somebody's probably like, well, where is she going? Why does she get to it? Why does she keep pausing? I'm pausing because we are old and we got to let the light bulbs pop on us. A lot of us are older and we got to let the light bulb pop. We got to put the 2 and 2 together. Yeah. So what are they getting you ready for? That's what I want to know. What are they getting you ready for, big boy? What are they getting you ready for, hot mama? They want you to think you were extra hot in your youth. They want you to think you were extra hot, big papa, in your youth. And that's how this happened to you. You know you were the big man on campus. Somebody might say I hadn't been the big man on campus 40 years ago. Start pulling up the belt. Pulling it all up like Barney Fife. Yeah, Andy, I am the big man, aren't I? Don't believe the hype. Don't believe the hype. They got something in store for each region. There's something in store for each region. Each region, there is something in store. Yeah. Alrighty, folks, we have been at this for 1 hour, and I'm so happy you guys were able to hang out with me. Thank you. I'm glad that you're following Mama Bear, Papa Bear. I'm glad that you're following Steve Willis. I'm glad that you're following R. Jones. You snuck in here. What's going on, girl? What's going on? Good to see you. Yeah, so, we desperately need to learn and then teach each other how to grow and use. Yes, we do. And we've got such a wealth of information. I don't see Sarah Brown in here, but Sarah Brown and Mama Bear, Papa Bear, and, oh, great Rachel. Oh, my goodness. There is a wealth of information here alone. It really is. It really, really is. Steve Willis and his wife, I mean, just great information on how to do what you need to do to take care of yourself. But I want to tell you guys something. I want to tell you something. Those last 3 stories that I read, keep your eye on your Medicare, keep your eye on Mama Nim's Medicare, keep your eye on this whole Medicare story. All right? By the time the story is published, you guys will definitely have everything inside of the description box so that you can click away. Okay? Yes, it does. It does, R. Jones. An inordinate amount of knowledge. Knowledge is always good when you can use it well. So, I love each and every one of you guys, but that last story, really, I want to drive that home. I don't know whether anybody was here last year when the zapping got done. There was some zapping. And the zapping was because of a specific situation that was shared. The women in here are very smart and knowledgeable, and so are the men. We got the Charlie Siglers and the Steve Willises and the Ronnie Men of the world, and we got the Alan Davises, and who else we got in here? Where is my man? Where is he up here? Where is he? I think he's gone already. Oh, where is he? Is Disciple of the Messiah one a lady or a man? But I'm looking for Melvin. There he is, Melvin. That's who I'm searching for. Searching. So let me ask you guys, did everybody, whoever was here last year, do you know what I'm talking about and which story that I'm talking about that showed that there was 3 pieces of a candy cane cut? And in between the candy cane, one piece of the candy cane had peanut butter stuck in it. Another piece of the candy cane had peanut brittle put in it. And another piece of the candy cane had Twix stuck in it. And they were not supposed to be in there. And definitely Roosevelt when he comes in. Absolutely. Oh, man, my dear sister. Good. Disciple of Messiah. We got all these strong men. We got all the alphas. Where the alphas at? Where the alphas at? Where are all the alphas? They're over here in my chat. So that candy bar had all of these different insertions. And all of those different insertions of the candy bar, of the candy cane, had 3 different things. One was peanut brittle in the right part of the candy cane, and then they put a little bit of Twix in one part of the candy cane, and they put peanut brittle in another part of the candy cane. You remember, okay, Steve? Good. As long as I got somebody to know I ain't tripping. That's why I say, now I'm watching the numbers because I just got to looking over at the sales for the candy, for Twix, to see exactly how much the percentage over last year did they sell Twix candy. I'm trying to see exactly how much more of the Twix candy they sold this year. Or actually, it would not be this year's numbers. It would be 2020's numbers. And then coming at the top of 2022, we'd be able to get a clearer number for 2021 to find out exactly. I hope everybody getting me. I know my brother does. All right, y'all. 1 hour, 11 minutes. We've been together, and I've been blowing my nose, and some of y'all been hoping I would blow my nose, and we've been drinking our coffee, and we've been hanging out together. And I just want to make a very good announcement. I'm a trip, but I ain't tripping. Candy bar varies by demographic. Sickening, I suspect the candy cane does as well. Yes. So I don't know if I should make this announcement or not, or if it's even an announcement to make. Tell you what, I'm gonna consult with the executive producer and the producer. Then I'll come back and let you guys know if it's something that I should share. Alan Davis, you take care of yourself, looking for someone in Southern Arizona to fellowship with. You know what? Let me see if my godmother is in Southern Arizona. I think she's in another part of Arizona. I'll find out and I'll let you know, Alan. She's so cool. All right, you guys, you remember what we always say here on this channel, and that is that man shall not live by bread alone, but by every word that proceeds out of the mouth of the Most High Yah. You guys take care of yourselves, and please take care of one another. Until we see each other again, please continue to be blessed. To receive instant notification each time I upload, please hit the subscribe button and the bell notification.
Helping